Hello, I'm Dr. Christina Vallen Malichewe from Tanzania, working as a lecturer at Muhimbili University of Health and Allied Sciences in Dar es Salaam, Tanzania. I'm happy to be here to talk about our challenges as in cancer care in Tanzania. Tanzania is a big country in East Africa, one of the East African countries that has a population of about 52 million people, and with about 69% of our population is in the rural areas. And cancer is a disease which is growing very fast in our country. And as I've been working at Ocean Road, which is the only cancer care hospital in Tanzania, and I've been there for about 5 years. The current situation of cancer, the incidence and mortality has been increasing since 2004 to 2006. We've been seeing patients like from 2,000 patients in a year to about 5,000 patients in a year. So the incidence of cancer has been increasing in our country, while the infrastructures are still the same. When I was working at Ocean Road, there were only 3 oncologists, which were radiation oncologists, and they were old radiation oncologists. One was the executive director, and 2 they were practicing. So it was very difficult to treat many patients who are coming from all over the country, a country of around 24 regions, to come to Ocean Road and being treated with their diseases. So this has been a challenge in our country. So what are the challenges that we are facing in our country? First of all is the infrastructure. We don't have a proper way of diagnosing cancer. You know, cancer, we need pathology, we need clinicians, we need different things in order to diagnose it. So the infrastructure is very poor. The second thing is human resource. We don't have doctors who are knowledgeable in cancer management. As I said before, most of our population is in the rural areas, and these few doctors who are present, who are trained in cancer, in management of cancer, are present in the cities, especially in Dar es Salaam and in Mwanza. So we have very few doctors, and most of them are radiation oncologists. We don't have any. There are only 2 medical oncologists that are available in the country, and they are all centered in the city. Another thing is drugs. Drugs are very expensive for most of our population to manage when they have this disease. So it's very difficult for a person or for a doctor, if you know about the person's disease, and when it comes to treatment, it's very difficult because treatment are not available, first of all, and when they're available, they are expensive. Apart from having some doctors who are trained in cancer, but still we don't have enough. The ones which we have, they are only trained in, as I said before, in radiation oncology. We don't have specialized doctors for different areas of cancer, like medical oncologists, pediatric oncologists, hematologists, etc. So you might find a patient who is having a problem like a prostate cancer being treated by a urologist, which is is improper. So those are some of the challenges which we are facing. I'm so grateful and thankful to Merck for being chosen as one of the first candidates to attend this Merck Oncology Fellowship Program in Medical Oncology. As I said before, in our country there are only 2 medical oncologists which are centered in the city, and most of them they are clinical oncologists, which they do both radiation and they prescribe chemotherapy. So what I've seen so far, it has made me being more thankful to the sponsors, because I've seen different ways of treating patients, different ways of diagnosing different diseases, cancer diseases, which is very different from where I'm coming from. And I know that after finishing this 1-year fellowship program, I will be a very different person in treating my patients, first of all. And since I'm a lecturer, I know I'm going to impact a lot of new knowledge to my students and new knowledge to my fellow doctors who are remaining there in Tanzania. And also, we'll do a lot of work with other stakeholders in this cancer management, like surgeons, to try to make or to form guidelines and protocols which will be helpful in treating cancer patients, not only in the cities like Dar es Salaam and Mwanza, but for everyone who is in other regions, in other areas, like in Mbeya, Sumbawanga, can use and treat the patients. Because using chemotherapy, it needs a small infrastructure to establish than using radiation therapy. So at least we can start with the medical oncology to spread it to other parts of the country. Then later on, radiation can come by making up protocols which can go to other part of the country, to other hospitals, referral hospitals. So at least for those diseases which can be treated using chemotherapy, then can be treated while the patients are there and do not have to travel to Dar es Salaam or to Mwanza for treatment.